Good morning, everyone. My name is Ruth Lawson. I'm an advisor working in policy division of the UK Department for International Development. So here really speaking from the donor perspective, reflecting on the conference and the way forward. I think first of all, looking back through the conference, what has really struck me is that we've seen such a large number of examples of success. Countries that have made progress in reducing under 5 deaths, but in particular accelerating newborn survival. We've also seen good examples of programs and interventions being implemented at scale. So as has already been said, we know what can be done and we've seen it happening. But we need to learn from that, and we really need to be looking critically at these examples to learn what it can be scaled up, what can be taken to other countries, what can we learn from, and how can we go forward. So we have a lot to learn from each other. But my key message really is thinking around the Global Newborn Action Plan as we go forward. Yes, it's very important to have ambitious goals for 2035, but we also need to focus on the now. We shouldn't lose sight of the short term. We heard at the beginning of the conference and throughout about the last 1,000 days. And this really is a unique window of opportunity, a chance to prove that progress can be made in the next 1,000 days, and then looking beyond 2015. So I think we should all go away with concrete action, both individually and for our organisations, around how we can accelerate that progress. So what does that mean for DfID? What does that mean for donors? I think first and foremost, as donors, we have to ensure that there is effective financing for newborn health. But we cannot see newborn health in isolation. We have to ensure that maternal and newborn health are mainstreamed within wider health system strengthening efforts. And I can see that working at 3 levels. Again, thinking back as a donor, my role within DfID, what do we need to do? I think our first step is to look at our own financing and our own programme portfolio. And I will be taking information from here back to my colleagues, both centrally in UK and at country office level, sharing this information, the evidence of what works, the success examples, so we can look at our portfolio to see where can we maximise newborn health, what additional interventions can we add on, what opportunities are there, and I take very much the point made by Kate, I believe, around the need to focus on newborns in humanitarian and conflict situations. We will certainly seek to do that. But most importantly, we need to align behind country-led health plans. It's come out through the conference, it's absolutely critical. So again, where appropriate at country level, as a donor, we need to support countries to sharpen their plans to better address newborn health. And then finally, as a donor, we need to work with and seek to influence the rest of the global community to harmonise funding, to make sure that it does better address newborn health, and most importantly, to ensure that countries can access the funding they need to achieve their own country-led ambitious health goals. Thank you.